Good afternoon, and thank you for joining me today. Today's topic of discussion is Asperger's. We're pretty much picking up where we left off before, but today we are going to what's called the DSM. We're going to discuss the DSM-4 versus the DSM-5. What DSM stands for is the Diagnostic Statistical Manual. It's published by the American Psychiatry Association, and it's a manual that is used as a guideline for diagnosing mental disorders. Right now, the DMS-4 that's currently in use have been in use since 1994. Come May of 2013, this year, they will release the new DSM-5. I'm currently in opposition of the American Psychiatry Association decision to delete Asperger's syndrome from the Diagnostic and Statistical Manual, the DSM. Mental health and professionals utilize the DSM as their diagnostic tools. The Asperger diagnosis has been defined independently in the DSM-4 since 1994. There will be changes in the DSM-5 that will move Asperger's diagnosis under a general term of autism spectrum disorder, along with two other distinct disorders including autism spectrum. This is expected to go into effect May of 2013. The decision to phase out Asperger's diagnosis continues to be a mystery. Although it is not clear, that experts still cannot understand and continues to have difficulties with validating studies related to Asperger's. This decision will affect the many years of progress made individually with this syndrome, and it will diminish the progress made by people diagnosed with Asperger's. An enormous amount of research has been done comparing Asperger's to autism. The results have been inconclusive. On one hand, the American Psychiatry Association admits that further studies are necessary to better diagnose Asperger's, and the syndrome are not the same as highly functioning autism. On the other hand, they made a decision to lump them together in the DSM-5. The justification is that the change will more accurately diagnose autism. My question is how? Question one, or point one, healthcare has become more expensive and health coverage is constantly going up. How bad will this situation become? Point two, it can require a series of testing to diagnose Asperger's, which may not be covered under insurance and could be costly to parents. This leaves room for people to be improperly diagnosed. It refers to a one-size-fits-all theory. If further diagnostic testing is needed to determine the diagnosis of Asperger, of autism spectrum disorder, insurance may not cover it. Point three, what happens to a person already diagnosed with Asperger's? Will it be necessary for that person to be reevaluated or re-diagnosed? This concern is still unsettled. Committee members of the American Psychiatry Association indicates that it would have to be worked out on state and local level. Individual states would determine services and treatments. What if, point four, what if people who may have been diagnosed with Asperger's failed to meet the DSM-5 criteria for autism spectrum disorder due to functional abilities. Will their needs be covered by insurance, or will they qualify for social programs offering assistance to them? No one has been able to answer these questions. There continues to be speculation about the cause of autism versus Asperger's. This leads one to question if they should be grouped under the same umbrella. Asperger's syndrome and the other two disorders, when lumped together, have some symptoms in common. Asperger's syndrome symptoms have been known to be less severe in many ways than the other two. A misdiagnosis could result in prescribing incorrect medication, participating in unnecessary therapy sessions, and may lead to worsening a condition. Thank you for joining me today, and have a great evening.